The exact small subset of mobile apps that we are focusing on are those things or those apps that transform a mobile platform, and today we know it in the shape of smartphones, into a traditional medical device that we have been regulating, or people have been accustomed to depend on those technologies. And the second part is when mobile technologies and mobile health apps are now controlling medical devices or becoming an accessory and enhancing the use of existing medical devices, we would regulate that as well. So those were the only two pieces of the vast majority of mobile apps that we were focusing on. And that's where we called in the guidance as a small subset of this big ecosystem of apps and health technologies that we would focus on. In the guidance, we articulated about 6 or so principles, that the general categories of mobile apps that are used with mobile technologies that the agency and CDRH in specific would not enforce compliance to the regulatory requirements. So let's start with the very top. I would say our first and foremost goal is apps that help patients manage their own health or condition with something would not be regulated. So let me give you an example to just follow up on that concept. Medication reminders were something that today we have a few 510Ks. We said in the guidance that that's not something that we would continue to focus on, because 2 points. 1, they pose low risk to patients when they don't work. And 2, we think those are beneficial technologies that actually help with medication adherence or other therapy adherence and compliance as people are trying to get better with their conditions or with their conditions. And there's some other examples we have seen is coaching. When apps help coach patients into the right behavior, to either be compliant with a drug or a therapy, or even take into consideration examples of instructions doctors give to patients, and coaching from that perspective, either to lose weight, either to quit smoking, or even to get off problematic drugs. Those are the kind of things. Or people who are coached for depression. All those kind of coaching applications would not be something that we would focus on. And the third one is there are some simple tools that doctors use today. The simple tools that we use as patients today in their homes or in practice. We would not continue to regulate them. And there are simple tools like APGAR score calculators and some very simple tools that calculates drip rates, converts the drip rate of a infusion pump to milliliters or something similar to that, is really what we are saying, that those are tools that are actually helping or enhancing care in a more standardized way, and we would continue to encourage that, and we would not regulate those or oversee them actively. People are concerned that FDA's policy of enforcement discretion can change overnight. That's not entirely true. If we were to change a broad policy, we would go through a public comment and review process before finalizing or implementing a broad change in the policy. So I think the message to folks is use the guidance as a guidepost to understand where your products lie in the enforcement discretion or not, and use that to innovate, use that to make sure that we are making our healthcare better going forward using these exciting technologies.